Good afternoon. On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Ambulatory Surgical Facility Tracking Tool, How to Gain Insights into Cancellations and Transfers. My name is Chris Mamrell, and I will be your moderator for this program. Now, I'd like to introduce our speakers for the webinar. Lea Anne Gardner is a Patient Safety Analyst with the Patient Safety Authority. Lea Anne has 30-plus years of research experience in patient safety, performance improvement, cardiology, and behavioral health. Our second speaker, Melanie A, is a Senior Patient Safety Liaison with the Patient Safety Authority. She interacts with patient safety officers and other various healthcare staff and healthcare facilities across the eastern region of Pennsylvania in an effort to decrease patient harm. Prior to joining the Patient Safety Authority, she worked in outpatient and inpatient settings as a Director of Nursing, Patient Safety Officer, Manager, Educator, and Registered Nurse. Lea Anne and Mel's most recent publications are on the topic of ambulatory surgical facility cancellations and transfer due to atrial fibrillation, and a second article which provides a perspective on how ambulatory surgical facility staff are addressing this issue. Lea Anne, I will now turn the program over to you.
Thank you, Chris. Hello and welcome, everyone. I want to thank you for joining us. I'm going to start by going over what the objectives for today's webinar is. The first one is to describe the importance of tracking ASF cancellations and transfers. And the second one is to explain how the ASF tracking tool can help identify patterns in ASF transfers and cancellations. This project started when Mel was contacted by a couple of ASFs regarding the topic of cancellations and transfers in an ASF in patients who had been diagnosed with atrial fib. Some of the patients had a known history and other patients had no history of atrial fibrillation. Mel and I started reviewing PACER reports that described ASF cancellations and transfers in patients diagnosed with new onset atrial fibrillation who were coming in for colonoscopies. We then expanded our scope to look at all ASF reports that described patient cancellations or transfers due to new onset atrial fibrillation. In addition to looking at the PACER reports, we conducted a survey on this topic in March of 2021. The December 2021 Patient Safety has an article describing our results. Mel and I also wrote a perspective piece on this topic based on interviews with staff from 3 different ASFs on this topic of new onset atrial fibrillation and cancellations and transfers. The PA PACER report and survey results both identified that gastrointestinal procedures were the most frequent reason for a cancellation due to new onset atrial fibrillation. Ophthalmology procedures were the second most frequent reason for a cancellation due to atrial fibrillation. While working on this topic, we decided to look at the authority's ASF cancellation and tracking tool that was developed in 2014. The development of the tracking tool back in 2014 was done by a request of ASFs that participated in an ambulatory surgical facility cancellation and transfer collaboration. This collaboration ran for 18 months. The focus was on improving preoperative screening and assessments to reduce day of surgery cancellations and transfers to acute care hospitals. I'm not going to spend much time going over the information in this slide and the next 2 slides. I'm presenting this information because it is part of the tracking tool and was developed during the collaboration, and it was developed by both the participants from the ASFs and the PSA staff. In this slide, you can see what the standardized definitions that were used during the collaboration. And this was for both cancellations and transfers. In this slide, it addresses standardized preoperative screening times, which was a focus of the collaboration. In this slide, a large number of day of surgery cancellations were due to no-shows, which is what focused us on to looking at potentially was pre-op screening an issue. So in doing this, we looked at 6 different pre-op screening choices that are here, and these are the ones you will see in the tracking tool. What I want to point out is that the last 2 choices, the no preoperative screening and unable to contact the patient, may seem to be the same issue, but there is a difference. Patients who receive no pre-op screening could be reached. They just didn't get any kind of preoperative screening. The patients who provided either an invalid, an incorrect phone number, or had no contact information provided to the ASF, those patients did not receive the pre-op screening and therefore were unable to contact the patient. And that's what distinguishes between these 2 categories. Another thing we also standardized was the time of transfers and patient characteristics. And these times here were from the actual collaboration itself. So it was preoperative and postoperative. That has been updated, and I know Mel will be going over that. What I did want to show you that the results from the collaboration. The ASFs that participated, and again, there were 11 of them in the Northeast region of Pennsylvania, experienced as a group a 9.7% reduction in their day of surgery cancellation rate. So it started at 29.6 pre-intervention and dropped to 26.8 post-intervention, and the rates are determined by per 1,000 completed procedures. And this result was statistically significant. We also looked at the change in the transfer rates, and those are measured as transfers per 1,000 admissions. There was a 14.7% decrease in the transfer rates, but because the numbers are so small and the differences were small, there was no statistically significant results from this decrease. So what I want to do is talk about the history of the tracking tool. It was built, again, as a request from the ASF so they could continue tracking their cancellations and transfers based on the work we did during this collaboration. And so we took a lot of the standardized data fields, so the rates, the time of the pre-op screening, and the reason for events. And within the transfers, we looked at the time of transfer, the ASA class, the BMI, and patient age. And these were put into an Excel workbook, and there are separate spreadsheets for each of these different sections. In looking at that tool and trying to update it, we also, in the survey, asked several questions. A lot of them were due to, or looking at, cancellations due to new onset atrial fib. But we also had 2 questions that we asked that were not related. Now, before I go any further, I do want to point out that we were really thrilled with this survey because we got over a 50% response rate, which was absolutely phenomenal. In looking at, though, the 2 questions that asked about generally what types of reasons for a cancellation, we ended up getting a lot more information, and it resulted in us retaining 4 of the reasons from the original tool that was developed in 2014. And in this new updated tool, we've changed and added 4 new or reclassified categories. And as you can see, these categories are listed here. So in the previous one, we did not have a separate identification for medical issues missed or identified during pre-op screening, which part of that came from this project looking at new onset AFib. Patient did not meet screening criteria. That was not a separate choice in the previous tracking tool. uncontrolled existing medical conditions, patient sick, and then we also added an other column. This slide talks about the transfers. So the reasons for the transfers that were in the original tool remain. There were no changes identified in the survey results. But what we did do is we expanded patient age, where originally it did not include all age ranges, now it does. We also expanded the body mass index, known as BMI. It did not, in the previous one, include patients who were underweight and patients who were normal weight. So those now are separate categories. And we added and expanded the time of the transfer. So as I just said on a previous slide, originally it was pre-op and post, but in looking at some of the reports with the new onset AFib, we noticed that sometimes transfers came and were discovered intraoperatively. So to reflect that, we now have preoperative and post-operative. So that concludes my portion of it. I would now like to turn the program over to Mel.
Thank you, Lea Anne. Okay, so thank you, Lea Anne, for giving us kind of the history of, how we decided to come and update this tracking tool that has been around since 2014, and I'm hoping some of you have taken advantage of it. And being that, we started looking into the new onset AFib, and we did this survey, we thought it was a great time to update it. So thank you for sharing those updates. So now I'm going to talk to you all about the tracking tools that we do have available for you. And I think we have a tool for everybody. So there are actually 4 different tools that we have available. The first one available is a single specialty. So this is really for ambulatory surgery facilities that do only one type of procedure. So maybe, you're a pediatric dentistry, urology, pain management. You may find this tracking tool available. Very useful, excuse me. The second one is endoscopic. So this is for my GI facilities out there. There are many of you. This is just specific to GI procedures. And then we have an eye tracking tool for all the eye centers out there. And then, of course, many of you are multi-specialty ambulatory surgical facilities. So this is going to include a wide range of procedures. So some of you I know do orthopedics, you do pain management, you do some general surgery, podiatry. You might actually do GI 1 or 2 days a week. This is going to be the tracking tool for you. And then in addition to that, we have a step-by-step reference guide, which is very well thought out, very well written. It literally walks you through every step of this tracking tool. We wanted to make it very easy to use. So this reference guide, I think, will be very beneficial if you get stuck as a troubleshooting reference, or if you want to understand something a little bit better. It gives you a little bit more rationale. So where can we find these tools on our website? I'm going to actually share my screen here and show you where you can find them on our website. They are there, and I believe Shelley is going to put this website link in the chat box to share with you all, and those you'll actually get it in the slides too. So I'm going to just show you. I'm going to share my screen here. I'm going to go to our home website. Okay, so this is the Patient Safety Authority home website. What you're going to do, you'll find these tracking tools under patient safety topics, lots of great information there. And if you go to Browse All, this will actually expand the list. We tend to highlight a few at the top here, but if you click on Browse All, it'll expand everything that we have available for you. So please take advantage of those. But just to point out, we have a new category here. It's called ASF Cancellations and Transfers. If you click on there, it'll take you to this overview page, give you a little overview about this topic. There's some key data and statistics, which I'm actually going to review in a little bit. And then under educational tools, you'll see all the way at the bottom here, ASF Cancellation Transfer Tracking Tool. If you click on here, everything that I just spoke of is going to show up and is available. And these are all zip files. The reference guide here, like I spoke about, this is really the step-by-step of how to use these tools. gives you the background, and it talks about each section, which I'm going to review. So I'm going to kind of give you the highlights of this reference guide as we go through more of the presentation and the demonstration later. So here's the multi-specialty, here's the GI, ophthalmology, and the single specialty. So that's where you can find them on the website. Okay, so the different components of the tracking tools. There's two major components of this tracking tool. So there are data-related spreadsheets and report-related spreadsheets. So the data-related spreadsheets is basically where you're going to enter your data. The first spreadsheet is the ASF cost calculator. This cost calculator is awesome. It's really a matter of putting in the number of cancellations you had, the number of procedures, admissions you had for the month, and this is by the month. And it allows you to put in, and I'm going to show this to you later, the costs of at the facility level and then also at the physician level. And it can show you how much money you can potentially lose based upon having these day of surgery cancellations, and also the increase in revenue if you actually decrease the number of cancellations. So I think this is a great tool to help get buy-in from leadership, and just to really spell out the numbers a little bit to see how this could be affecting your facility. The next data-related spreadsheet is your cancellation rate. So your cancellation rates, you're going to be able to put 3 different types of cancellations in here. You're going to be able to do 3 periods of time. So your day of surgery cancellations, surgeries within 24 hours, canceled within 24 hours, and then 48 hours. So this is great. Day of surgery cancellations, most of those are reportable into PA Pacers once that patient is registered. Sometimes you have day of surgery cancellations where, people call the day of and say, hey, I'm sick, I have a fever, I have to cancel my procedure. You can track that in here. And then also, leading up to 24 hours, 48 hours. If you're having a number of 48-hour, 15, 48-hour cancellations, that might be a concern. You may want to trend those to see what's going on. And same thing for transfer rates. So your transfer rates, I'll show you that, all of that information a little bit, but it's going to allow you to trend, how many transfers you had within the month based upon how many procedures. And that's going to give you a nice trend rate, transfer rate for, to look at over a period of time. And then a little bit more detailed information, your date of surgery, cancellation information, and transfer information. So this is where you're going to be able to, if you had 3 transfers in the month of January of 2022, you're going to be able to put in a little bit more detail about those. So, the patient ID number, the date of the transfer, was it a pre-op transfer, a post-op transfer? What was the reason for the transfer? And there's some opportunity to free text some more information. So I'm going to show you that in just a little bit. And then your report-related spreadsheets, this is great because you just enter the information and we have the formulas built into this tracking tool already. And we have these different reports that you can share. You can keep for yourself, you can share within your facility, up through your leadership. So cancellation rates, transfer rates, there's some great line charts, date of surgery cancellation reports, and transfer reports, which I'm going to show you in just a little bit. And what's great about these tracking tools, you can just download them from our website. So some of you may be, wanting to start this month in February, and you may want to track it for a month. So it's really, you can track for up to 12 months, and you can define that as the user. So if you want to start tracking, for 2022, you can start in January, or if you want to start in July, if you run on a fiscal year, I know some of you do, you can start there. So it really is defined by you. If you're going to be tracking these for a quality project or a performance improvement project, and you're going to be, just looking at the second quarter, you can start that April. So it's really defined by you, which is really great. And if you need another one, you can just download it from our website and save it to your computer personally. Okay, so let's talk about using the tracking tools and what you can do. So I mentioned before, collecting data. We love to collect data. We can track and trend cancellations within 48 hours, within 24 hours, and of course, day of surgery or day of the procedure. And like I said before, you can calculate the cost for day of surgery cancellations. This can speak volumes, depending upon how many cancellations you're having. I know some of you will go months without a cancellation. And then sometimes, you're having like 6 cancellations, 10 within a month. Why is that happening? And this tracking tool can help you dive a little bit deeper into that information. And like I said, to track and trend transfers as well as cancellations. Generating reports, easy trending. There's no formula building. We did it all for you. So it's just a matter of plugging in the data, and these reports that I'm going to show you, you can share within your facility. You can share at your patient safety committee meetings. Maybe you need some help from your patient safety committee. Then you need their feedback on how can we, prevent this from happening. You can get some feedback from them on, different protocols or maybe a policy change. We'll talk about some of that. Quality performance improvement. You may find this is a great quality or performance improvement project. I know many of you are AAAHC and Joint Commission accredited, and you're required to do so many, per survey period. This may be a great project for you. And then, of course, to share with senior leadership, and then all the way up to the board. So these are really great, easy reports that I think you'll find beneficial. And then most importantly, you're collecting this data, you have these great reports. Now, what are we going to do about it? We want to be able to take action. Tracking and trending, it's great. But now, with this tool, you might be able to identify reasons for these cancellations and transfers. So you may find, when you're entering this information, you're seeing an uptick in cancellations, just maybe you had a new doctor come on and, is there something different about this doctor? Is he not doing pre-op screening, or are you doing it the day of? When is it happening? I know many of you, some of these patients are scheduled, a month beforehand, sometimes 2 months, and they're given instructions, by the surgeon or by the scheduler that day, and they're not looking at it until the day before they're coming in. Are we giving those patients a call, a few days before to remind them, of their instructions, of their upcoming procedure? I know some of you, there's some great technology that's being used now with text messaging to remind people that they have a procedure coming up and that, they need to follow the instructions, to prompt them. I know many of us are on our phones and we rely on that instant gratification, and we're finding creative ways to get in touch with people. Patient education. Are we finding, one of the top reasons for cancellations are people not following instructions? Why are they not following instructions? Do they not understand the instructions? Do they have old instructions? Maybe you provided a new instructions, to the office that schedules the procedures, but they're still using old ones. So that, by tracking them, you're going to find that out and hopefully can, create a process so they can get rid of those old ones and use the new ones. Identifying potential gaps in facility processes. Not all patients are screened preoperatively. Maybe they used to be screened preoperatively. I know some of you, with the current pandemic going on, are dealing with some staffing shortages, and people are getting pulled in many directions. Did you used to do nurse pre-op phone calls? Now that you're not doing that, are you seeing an uptick in cancellations? Using this tracking tool will show you, some potential gaps and potential for, different opportunities to create new processes and to think outside the box to prevent these cancellations from happening. And like I said, identifying patterns and trends. Are these occurring pre-op or post-op? That's one of the new drop-downs. Not just transferring a patient. Are you finding that, all of your transfers are happening post-operatively? Is that a coincidence? What's going on there? Are they all pre-operatively? Does it have something to do with BMI or the ASA class? Most of you are class 1, 2 facilities, and some of you may have a Class 3 exception. Are you always transferring those Class 3 individuals? If so, what can we do to prevent transferring those? Is there anything that we can do? Is there something that we're missing on preoperative screening per se? Are we, missing a question? How are we asking that question? Doing all of this is, using the tracking tool can help you dive into this. And these are really great performance improvement studies that you can do within your facility to improve your processes and really overall improve patient safety. And I think the major takeaway here is we, as a patient safety authority, we're always trying to find ways and provide you different tools to help you in your everyday operations. And we know cancellations and transfers, they've been one of the top 3 event types reported into PA Pacers over the past 5 years. So this is definitely something we see on a regular basis from our ambulatory surgery facilities. So how can we prevent some of them? Some of them are not preventable, but it's always good to look to see if there is. And really, this is going to help us provide safer care to our patients. It's going to allow us to be more efficient and effective in our patient care, consistent workflows. When we're canceling and transferring patients, it's a big distraction. If we can, decrease them a little bit, that's going to minimize our distractions. Patient satisfaction, people are happy when they're communicated with and they understand, what to expect from their procedure. They understand their instructions. They sometimes are disappointed. Obviously, if you have to cancel them, the day of surgery, maybe there is a missed medical condition and they needed to hold their Coumadin for a few days before their procedure, but no one told them that, but then nobody actually knew that they were on that because they, maybe the facility doesn't do preoperative screening until the day of surgery. So there's so many different things that can be looked into by using this tracking tool. Okay. And I just wanted to share this information. This comes from the survey that Lea Anne mentioned that we did just almost a year ago already. We did have a 53% response rate from our Pennsylvania ambulatory surgery facilities. And this figure right here is showing you the top 4 reasons for cancellation. So you can see here, the top 4 are preoperative instructions not followed. Okay, that's the number 1 reason. Number 2 is medical issues missed, identified during pre-op screening. Number 3 is no-shows. Why are they not showing up? Do we have the wrong phone number? Can they not afford their copay? I know financial issues is on here, but those are some things that you can dive into a little bit more. Patient didn't meet screening criteria. And then the top 4 reasons for transfers, the number 1 reason, cardiac arrhythmia. Number 2, anesthesia complications and aspiration. Number 3, hypertension. And number 4, pain management. So this is all referenced in the articles, which are referenced at the end of this presentation that myself and Lea Anne worked on this past year. So really great information. I think you'll find it interesting as well. And lastly, before I get to the demonstration, I want to talk about just how easy this is, the benefits of using the tracking tool. We know you all work very hard to keep our patients safe, and we want to make sure, our tools are easy to use, they're relatable to what you do. And I really think, I may be a little biased, but I do think this tool, it's efficient, it's structured, you can download it, it's easily accessible. And it's really plug in the data and it's at a glance info. I mean, you can, plug in all of January at the end of the month. I think it's just making the time to do it, or, as they're happening, you do it and just build it into your process. I think you could take, great advantage of this tool for those reasons. So now I am going to show you what these tools look like. We did a lot of talking about them. So let me share my screen again. So the first tool I'm going to show you you can see at the top here, this is the multi-specialty tracking tool. So I did fill in some data for these demonstration purposes, and I didn't want to sit here and fill in data and bore you all to death. I really wanted to kind of show you some of the features and maybe enter a little bit of data. So as you can see, I filled this in for January 2022, the longest month of the year so far. Looking forward to the spring for sure. So you can see here, like I mentioned, this is the cost calculator. So here, right here, you're going to enter the total number of data surgeries completed procedures. So how many procedures did you do in January? Hypothetically, let's say you did 220. You had 4 cancellations that month. It automatically calculates the cancellation rate per 1,000 procedures completed. Facility level cost of cancellation, this is all going to vary by the facility. Some of you are hospital-based ambulatory surgical facilities. Some of you are single standing. I may have some outpatient hospital ASFs listening. So you are all reimbursed differently, and you know this information better than I do. So I put in some data here based upon, just hypothetical data, but let's just say the facility level cost of cancellation is $5,000. Physician level, and this is going to be average depending upon the type of procedures that you do, is $1,000. So you can see here potential cost savings by decreasing date of surgery cancellation. So you can see here this first column here is your current. So 4 cancellations for the month of January, 18.2 cancellation rate, lost revenue is $24,000, so $6,000 per procedure. So you can see this keeps going down if we did 10% fewer, 25%. So let's just look at 50%. If we cut this in half to 2 cancellations per month, what does that change? Obviously, it cuts the cancellation rate in half. Additional revenue, $12,000. If we have no cancellation rate, that's $24,000 per month that we're gaining in revenue. So, if you track this throughout the year, that's a lot of money. That could be another FTE. Maybe, you're looking for another pre-op screening nurse. This may help you get that. So this is really a great tool, to look at the cost of doing business and how cancellations, especially data surgery ones, can affect your facility.
Mel?
Yes.
Mel, just real quick, can you go back up to the top to the date?
I know you
showed. Thank you. I know you showed where it's at, and I'll just take a minute. You really need, even before you get to the calculator, put the date in, because that will then put the dates in all the other successive spreadsheets. You don't have to do that. That's all I wanted to say, so people know that.
Thank you. Yeah, thank you for that. Okay. All right. So that's the cost calculator. And this is on all of the 4 tracking tools I mentioned: the single specialty, multi-specialty, which I'm demonstrating now, the GI, and then also the eye. So the next tab here are your cancellation rates. Okay. So you can see here, this is where you're going to enter the information. I already have some information entered in here. So for January 2022, I had 4 data surgery cancellations, number of procedures completed, and you can see there's that 18.2 cancellation rate. And here, it's really a matter, let's say I knew March, let's just say I had a big uptick. I had 6 cancellations that month. We were really busy. We did 350 procedures. All that information is going to pre-populate. And you can see here right below, it's going to give you your cancellation rate with the months on the x-axis and per 1,000 procedures completed. Pretty easy to keep track of this. 24-hour cancellations, there's a little button right there, or you can just scroll down. Here you can see I had 3 cancellations within 24 hours. There's my total number of procedures completed for that month. March, let's just say I had 2. Again, that 350 automatically populates, which is great. Your cancellation rate is going to automatically populate here. And then if you scroll down or click on Go To, here's your 48-hour cancellation rate. 6 Cancellations within 48 hours, there's that 220 procedures completed. That's a 27.3 cancellation rate over, the 48-hour time frame. Okay, so that's your cancellation rate. Pretty simple. Putting in how many cancellations you had, total number of procedures, calculate your cancellation rate. Next, your transfer rates. Okay, so here's for the month of January. I had 4 transfers. I had 2 transfers in February, and that's going to calculate over here. This is for January, February, and this is a pretty simple worksheet. You can go right down and enter this information. 5, let's just say, that's a lot of transfers in a month. And then 14.3, okay, that's your transfer rate. Date of surgery cancellations, okay, so this is cancellation information. This is where you're going to fill in some more of that detailed information. So, these are more high level. This is how many we had. We're trending. The cancellation information, this is where you're going to get a little bit more information. And it's great. Let's just say, we're in February now, and I'm going in, I can add this information, top of the spreadsheet. I can click on this, and it's going to take me right to the top here, and I can go to any of these months throughout the year. So it's very easy to get around, very simple. So here, you can see patient ID, the date of the event, the time preoperative screening is performed. I love this because these are all drop downs. So they're predetermined already, and you just need to choose day of surgery, 24 hours, 48 hours. One thing I do want to note, if you try, some of you may use medical record number, maybe even event number. You can't enter information. If I try to enter information here, let's see, if I try to put something in here for January, let's say 31st. Oops, getting ahead of myself. I'm going to get an error message. Data cannot be in a line without a patient event ID. You have to enter a patient event ID in order to continue putting information in here. So, if you're just doing this for tracking purpose, you may do what I'm doing, 1, 2, 3, 4. If you want to do a deeper dive, you may want to put the medical record number in here. Type of procedure, this is the multi-specialty. So you can see here, we have eye, plastic surgery, ortho, urology, other, if there's one I'm not thinking of, GI. So again, just a drop down, you just need to click on it. And you can see I'm going to get yelled at for not putting a patient ID in there. Reason for cancellation, again, this is all predetermined. Lea Anne spoke about this. We took advantage of this survey and updated this based upon the information you provided us. So was this, you can see here, patient number 1 here was a no-show. And we did the preoperative screening 24 hours. That's interesting. Why did that happen? So here, this was day of surgery when pre-op screening was performed. Patient was canceled, not following instructions. He drank coffee in the morning. I love my coffee in the morning, but typically, most of the time you have to be MPO for a certain period of time, and it looks like I spelled coffee wrong, so I'm going to fix that. But it's great. So, here, this is really free text information. This isn't going to go to any of the cancellation reports. This is really for your own records, to provide any additional details you want to, or general comments about monthly cancellation. So, maybe you saw something in the month of, in December or last year, like look back at November. This is really for your own record keeping. And then here are the dates. This is January, here's some February, and here are the reports. Again, really easy. Plug in that information, and all of this information plugs in no problem. I'm going to increase this to 100%. So here, this is a report on time preoperative screening was performed. So you can see here, 50% of those were performed in the day of surgery, 50% of those day of surgery cancellations were performed 24 hours prior. These are cancellation reasons by procedure. So you can see this is these are horizontally stacked because there's so many different types of procedures. but 25% preoperative instructions weren't followed, 25% new or missed medical condition. You know, and you can see here the total of the 4 patients. This is for February, and then so on. So let's say you want to, you know, you have your patient safety meeting coming up, and you want to print these reports. So you can actually go to File here, and you're going to hit Print. And you know, this is going to want to print all of them, but you can select what pages you want to print and just print. Let's say you just want January, February, and March. Maybe you're doing your quarterly patient safety meeting. These will print out nice and separately on individual sheets, so they're very readable. You can just print, you know, pages 1 through 6 for your quarterly meeting. So very easy to read, access, and print. Transfer information. So this is a little bit more detailed information about transfers. Okay, so here's January. Again, you got to make sure you put in that patient ID number. Otherwise, you won't be able to put any other information in. Date of the event, time of the transfer. This may be really important. Time preoperative screening was performed. You know, are you having a lot of day of surgery cancellations because they're not meeting screening criteria? Age of patient. Okay, like Lea Anne said, we added every age. Those are all predetermined. BMI, okay, this is important in healthcare. What ASA class were they? Okay, and then, you know, this is all predetermined here. Type of procedure, these are the same as what I showed you before, and the reason for transfer. And this is based upon the updates we received from the survey from all of you in March of 2021 in the collaborative a few years ago. And again, details and some general comments. And then these are more great reports. Once you enter that information, here you can see transfer, time preoperative screening performed. This is by age. How old were these people that we transferred? Transfer, you know, BMI. Are we, you know, transferring people, you know, with a lower BMI or a much higher? You know, like I mentioned before, ASA 3. You may have an exception to do ASA 3, but are we always transferring them? Hopefully not. But it's great information to keep track of. And then here are the reasons for transfer. So we have dehydration, bleeding, hemorrhage, perforation, anesthesia complication, chest pain, hypertension, everything we mentioned earlier in the presentation. So this is the multi-specialty. This is, you know, the largest of the tracking tools because there are so many different types of medical procedures. So the other one I'm going to demo, this is the GI, the endoscopic tracking tool. So this is for my GI facilities out there. Again, I put in some information here. I started with January. Like Lea Anne said, that will pre-populate the rest of, the workbook for you. And, you know, here we did, you know, there's 200 procedures completed in this facility. We had 10 date of surgery cancellations in the month of January, and that gave us a 50.0 cancellation rate per 1,000 procedures. Again, facility level cost of cancellation. This is information that you can fill in based upon the type of facility you are. And you can see here, you know, cutting this in half, that's an extra $30,000, you know, we could be seeing on our bottom line. If we'd had no cancellations, that's $60,000. So really, hopefully beneficial information. Hopefully you find this helpful within your facilities. This is the same thing as what I showed you in the multi-specialty. So you have the day of surgery cancellations, you have within 24 hours, and then 48-hour cancellation rate. Transfer rates, same thing. This is very easy to print. I'll show you this. So maybe, you know, you're doing a project on transfers. You're going to go to File, you're going to go to Print, and then you can, choose to print, maybe you want this data, or maybe you just want to see the trend line of the transfer rates for the year. And this is great to compare year to year. I know some of you, just keeping track of, 1 to 2 months, depending on, the facility, that might not be, beneficial. You might need to track a little bit longer depending upon the number of cases you're performing in your facility. And then one thing, really important to point out here under data surgery cancellation information, all of this information is the same from the multi-specialty, but you'll see for the single specialty and for these specialty specific, these are only GI procedures. So you can see here we have colonoscopy, EJD, GI, and then of course other. And then the reason for cancellations, these are also all the same as in the other workbook tracking tool. Okay, I don't want to repeat myself too much, but hopefully you got the gist of it. And again, we have that reference guide as a great reference for you to really look through and to give you some rationale and what some of this means. It's really step-by-step, helps you walk through it. And then you also have us, your PSLs. So if you need help, you want some more information, please reach out to us and we'll gladly help you with this tool. And yeah, this is all the same. I'm going to stop sharing my screen. Chris, I'm going to turn the program over to you.
Well, thank you, Lea Anne and Mel. This does conclude the slide presentation portion of our program. All right, I have my first question here coming in. If I want to use the tool for a second year, can I copy and paste extra spreadsheets?
Hey, Chris, it's Mel. I can answer this. So you don't need to do that. That's a lot of work. You don't need to back out all the data. All you need to do is, go to the website under the patient safety topics and download another tracking tool. They're there for you to download, as you need them. So if you need them on an annual basis, just make it easy and download a new one, and don't back out all that data that you already put into the tracking tool.
Sorry, I was muted. I have another question. Is there any cost to the tracking tool?
There is no cost to the tracking tool. You can go to the website right now and download it for free.
Excellent. So I have a question from somebody that's already used the tool. First of all, thank you. That's great. I entered data into the wrong month, and when I tried to delete it, I got an error message and didn't know what to do. So maybe you can provide some guidance there.
Sure. What happens is if you put the data into a line like Mel was showing you, first you have, in order to enter it, you have to put the number in. But in order to remove it, you have to remove all the data, even the free text, even if there's a space. Delete all those out so that all you're left with is that number and the patient ID. Then you can delete that number out and everything gets removed. I hope that's clear because you can't just delete the number and the data at the same time, and it's just due to the programming.
Okay. I want to remind everyone that if you do have additional questions, please type them in the Q&A box. And direct them to all panelists. While we're waiting, if there's any information you would like to share, either Lea Anne or Mel, I welcome you to do so.
I think the one thing I would like to let everybody know is if you do try, to Mel's point, with the copying and pasting of the spreadsheets, you'd either have to clear out the data, but you cannot copy and paste them because there is they're locked. Another option is download the current one, save it as a template, and then use a new workbook with the data, and then you always still have the template if you want.
Would that method allow end users to maybe customize like the cancellation reasons and those kinds of things as well?
No, it's very set. All it means is that if they say you download it and you use it for a year and you want to get it again, you can either come back to the authority website, because it will be there, or if you download a copy and just save it plain, you have a template that you can keep going back to. So there's one or two ways to access a new template. But you really can't do any kind of changes in the programming.
I think that makes sense with all the reporting and such built in. I have a question. If as people are using this tool, they have recommendations or suggestions, if they basically want to contribute to maybe the next version of this tool somewhere down the line, how can they go about doing that?
I think my suggestion would be to have them talk to their PSL, and that way then any new information about what they see as maybe for the next version, we can then look into.
Okay.
I agree.
Great.
Oh, the other thing I wanted to say, I was trying to think of it, and I'm sorry, it finally came to me. On the single specialty, there are no actual procedure types. So it has all the other features that Mel showed you. It's just in the cancellation and the transfer, it doesn't have a procedure type since it's considered a single specialty. It does have the event date, it has the pre-op screening time, it has the reasons for cancellations, and on the transfer side, it has all the other fields except the procedure type. And in those, for those who will use the single specialty, you can easily customize as far as like what type of procedure it was in the free text fields. Granted, it won't show up in the reports, but at least you will have a record of them in the where you enter in the data.
Okay, thank you. Then we have a question for, in the tool, does a procedure equal a case? They're asking because some patients have more than one procedure during a single visit.
The tracking tool right now only has selection of a single procedure. So again, like in the multi-specialty, it would be gastrointestinal. If, say, it's an endoscopy center and they had a colonoscopy and an endoscopy, they would have to either select one, or if they put two in, one for the colonoscopy and one for the endoscopy, they could put a note in the free text field that this is the same patient, but they were tracking both. I hope that answers the question.
Okay. We'll be ending soon, but I just want to thank everyone for joining us today. And if you experience any issues accessing the evaluation or getting your certificate of continuing education, please feel free to direct any inquiries to Sherry Meixel, and you can see her information on the screen there at the bottom of this slide. You can reach her at shmixell@pa.gov. And I'm looking, I think we've answered all of our questions, so that will conclude our webinar today. Thank you.